basically what you're gonna need is a stethoscope with blood pressure cuff, along with some type of an anemometer, along with a disinfectant to wipe or clean the items that are not disposable. Perform hand hygiene. Don the appropriate PPE if necessary. Collect the vital sign measurement. You'll be checking the patient's blood pressure, heart rate, respiration, and temperature. In addition, we will also be asking the patient pain rating, which is sometimes referred to as the fifth vital sign, along with the collecting of the patient's oxygen saturation. Hello, now I'm here in the patient's room after doing a hand hygiene. And so I'm going to introduce myself to the patient and tell him what we're going to do. Hello, sir. I am Joanna. I am the radiologic technologist here, and I want to take your vital signs. Is that okay with you? Next is do a patient identifier by looking into their armband, having them tell you their name and their date of birth. Sir, can you tell me what's your name and your date of birth? Next is to start with a vital sign measurement. You can start with the easiest one, which is the pain level or pain rating. You can ask the patient the pain level, especially if they had a surgery or had experienced any type of trauma. You can do it in various scales. Usually we use 0 to 10 numerical scale. So ask or tell the patient, sir, will you tell me with a scale of 0, which is no pain at all, and 10, which is the worst pain you've ever had, what is your pain rating? Well, if the patient said 0, that's easy. But what if the patient said 8? What can you do is to ask for more questions like, sir, where is your pain located? Can you describe it for me? Then document that and the pain rating along with the word the patient used to describe the pain and also its location. What you're going to do is to measure the patient's oxygenation status. And you're going to do that by using a portable device like this. So you're going to place the device on the patient's nail bed, because this is where you're going to get your measurement or your reading. Now make sure that you pick the right fingers that has good circulation. Usually they are nice, warm, and pink. Next you want to do is turn on the device and put the device on the patient's finger. To get the reading. And the patient's saturation level is 94. And so the normal saturation level is between 95 to 100. Okay, so you're gonna remove the device and you're going to wipe this with a disinfectant. And you're going to document the findings. So the next in the vital signs measurement of the patient is the checking of the body's temperature. And so in adult, it vary. It can take anywhere between 97 to 99 degrees Fahrenheit. And it is considered a high temperature if it is more than 100.4 degrees Fahrenheit. There are various ways to take a temperature reading. Orally, forehead via the temporal artery, tympanic via the ear, rectally, axillary. Alright, so those are ways we can get or obtain temperature reading. The rule of thumb here is that the tympanic temperature and the rectal temperature are 1 degree higher than oral route, while the temporal temperature and the axillary temperature are 1 degree lower than the oral temperature. And so what I'm going to do today is that I'm going to hold the temperature probe plush against the skin or against the forehead of my patient. All right. And so after that, I'm going to read. So after that, if after taking the reading, temperature reading of my patient, I am going to wipe with disinfectant, and that I'm going to document the findings. Okay? Next is to find the patient's pulse. So we're going to look at different things, and we are going to feel the strength of the pulse. So to do this, you can use the number 0 to 3, with 0 as the absence of pulse, and 1 plus is weak, 2 plus is normal, 3 plus is pounding. So the plus rhythm is telling us if it is regular, if the pulse is regular or irregular. So in adult, the most common pulse site is the radial artery. So because it is easy to access. So what you want to do is to find that thumb, and below this is your wrist area and the radial, along with the radial bone. And whenever you are checking the pulse of the patient, they can sit in the bed or lie down. Extend the arm and support it. You're going to use your first 3 fingers to feel the pulse. Don't use your thumb because the thumb has a pulse on it. So use your first 3 fingers and find it within that area. And just lightly press it. Don't press too hard to feel the bounding of the pulse. So you're going to count it within 30 seconds if the pulse is regular. Let's start. Okay, so if you find that the pulse is irregular, what you're going to do is to count it for 1 full minute. Normal heart rate in adult is 60 to 100 beats per minute. So what we're going to do next is we're going to check or assess the patient's respiration. So when we're assessing the patient's respiration, we are looking at a couple of things. First of all, the rate. In adult, it is 12 to 30 breaths per minute. We are also looking at the depth. Is it labored or unlabored? So the rhythm of the breathing is regular or irregular. The best way to do this is to look at the patient's side. So watch their dress or their gown. Are they rising or falling? Because one rise and one fall is equivalent to one breath. If you see that the breathing is regular, so you have to count it for 30 seconds. But if the breathing rate is irregular, then you have to multiply it by 2. That means that you're going to observe the patient's respiration in 1 full minute. Okay? So let's start. Okay, so at this time, the patient's respiration is normal or regular breathing. And then after observing or assessing, you have to document your findings.